My name is Amanda, and today I will be talking about how you as a caregiver can reduce the risk of falls of older adults in their homes. My goal is to inform caregivers of older adults on the risk factors involved in falls and the ways to prevent them from occurring in the homes of older adults. So who's at risk? While everyone is at risk of experiencing a fall, the age, gender, and health of an individual can affect the risk of falling. As age increases, the more likely a person is to experience a fall. This graph shows that both men and women fall more as they age, but it also shows that in each age group, women fall more than men. One reason for this is because women are more prone to developing osteoporosis, which is the thinning and weakening of the bones, which increases the chance of a fracture causing or resulting from a fall. As a caregiver, it is important to be aware of who is most at risk of falling in order to prevent a fall from occurring in the home of an older adult. So next I'd like to share a couple of facts with you. Approximately 1/3 of American older adults who are 65 or older fall every year. 1 out of 5 of these falls causes a serious injury such as broken bones. The wrist or the hip are some of the common ones. Some people also get head injuries, and falls are actually the leading cause of a traumatic brain injury. Each year, 2.8 million older people are treated in the emergency departments for fall injuries. And many people who fall, even if they're not injured, become afraid of falling. This fear may cause a person to cut down on their everyday activities, and when a person is less active, they become weaker, and this increases their chances of falling again. So there are two different categories of fall factors. There's intrinsic and extrinsic. Intrinsic are those originating from within an individual. These include how well someone can see, their level of muscle strength, and whether or not they use medications. Some medications increase dizziness and fatigue, and extrinsic factors are those occurring outside a person. So these include the environment, the use of assistive devices such as a cane or walker, and what clothing or footwear the person is wearing. So both of these factors can increase or decrease a person's risk for falling, and the more risk factors that are present, the more likely someone is to experience a fall. So this graph shows where older adults are most likely to fall. The majority occur within the home or outside, but near the home of an older adult. Away from the home can be places like stores, parking lots, and other people's homes. And as we get older, what we used to see as harmless items become things that pose a threat for falling. So these items can include stairs, extra clutter around the home, and even our pets. So many of these hazards can be minimized with some attention, time, and with the assistance of a caregiver. Alright, so this model breaks down some of the hazards in each room of a home. We'll start in the bathroom, which is the most dangerous room of a home. According to AARP, falls were the cause of 80% of all bathroom accidents that caused hip fractures. Some things that can be done to prevent falls are to install grab bars by the toilet and shower to help with the balance. You may also consider installing an elevated seat on the toilet to make it easier for an older adult to stand back up. The use of non-skid strips or bathtub mats can also reduce slipping in the shower. So the kitchen is also a dangerous room due to spills and storage. So we want to be sure to store items within the reach of an older adult. We don't want them standing on furniture to be reaching for things. It's also important to clean up spills right away and keep the floor dry. And be sure that chairs are at the right height for sitting at the dining room table. So when we go into the bedroom, you want to provide plenty of lighting so that an older adult will have a clear view of their room. It's also a good idea to keep items close to the bed, such as the lamp or tissues, and maybe even put a flashlight next to the bed in case that older adult needs to get up in the middle of the night. Again, be sure that the bed is at a good height so that an older person can get in and out easily. Modifications can also be done in the living room. First, arrange furniture in a way that allows clear walking paths. Remove any throw rugs and just Throw these away off of the floor. Provide adequate lighting throughout the room. And remove any clutter right away, and avoid leaving phone cords and loose wires on the floor. Next is the stairs, which sometimes can get forgotten about. So you want to install light switches both at the top and bottom of stairways. And if the stairways don't have handrails, you'd want to install at least one of these, but ideally you'd want to install them on both sides of the stairs. You'll also want to consider the outside areas of the house, especially during winter. So you want to make sure that the older adult has boots or shoes that have a good traction on the bottom of them so that they prevent them from slipping on any ice. And lay down salt or sand on sidewalks, stairs, or driveways, and look around, see if there's handrails and adequate lighting. If there isn't, install these as well. So this is my mom. A few years ago, she was on her way out of the house, and her feet kind of got caught on a rug underneath her, and she ended up falling down 2 concrete stairs and landing on the driveway. She ended up breaking her wrist. She also hit her head when she fell, which was a big gash on the back of her head. Thankfully, though, she recovered from her fall without any further complications. However, she did develop what is called fallophobia, which is the fear of falling again. So many other older adults who fall experience this, and rightfully so. Their chances of falling again are increased. Many adults who fall may not have physiological risk, but they may limit their activities, which results in decreased muscle mass and increasing weakness. So this is when it becomes especially important to consider modifying their home to build their confidence and reduce their risk of falling. You may also want to consider implementing exercise to build their muscle strength and balance. Things like Tai Chi, yoga, core exercises, these have all been shown to reduce the risk of falls. So talk with a doctor, be sure that the older adult can participate in these activities. So I've shared with you today the different risk factors for falls, as well as where they are most likely to occur. I've also shared different modifications that can be implemented in the home of an older adult to reduce the risks of falling. By taking time and implementing changes in the home, falls can be prevented. So now I'd like you to test your knowledge. So looking at this image, what could this woman do differently to reduce her risk of falling? Could she A, arrange the kitchen so that commonly used items are within reach? B, use the counter for better support? Or C, nothing, she is not at risk for falling? Yes, so the answer is A. You want to arrange the kitchen differently so that she can reach things easily. So some concerns that are in this image is that she's standing on a stool that's very unsteady with a vacuum right next to her. So, you'd want to first have her get down from the chair, put that away, put the vacuum away, and if she does need to get up, provide her with a stool that has a grab bar, so that she can kind of step up on that. It also looks like she's wearing flip-flops, so maybe get her some different shoes. And if you can't get a step stool, then have her just know that she can come and ask the caregiver or someone else who is in her home to reach for the item. So here's another one that I want you to test your knowledge on. I'd like you to identify the risks in this photo, and there are 5 of them. Yes, so one of them is the throw rug. We just want to remove that completely. Some people might want to tape it down. Just get rid of it. Yes, and there's a cord also running across the floor. We want to be sure to get that up off and put away somewhere else. Yep, we want to move the shoes. Just store them in a place that is up off of the floor. So I think that's 4. And then the last one is to move that lamp and the tissues closer to the bed. And you could even consider, I don't think that they have a flashlight in here, but put a flashlight on the side tables as well, just so if they need to get up at any point in the middle of the night and don't want to turn on the light, they can easily grab that. Alright, well, thank you very much.